Beh, sì. Ever since I started getting too political, like believing in freedom and human dignity, people have been calling me names. They told me I'm a woman, I'm a cuck, I'm a bitch. I want to address this in a serious way because using the term woman as an insult tells me people have a very different idea of what women is. Because to me, women are nurturers, women are givers of life, women are the reason we're here, women are CEOs, women are firefighters, women are badass. So you can call me a woman, please do, because I think women are basic. You may not like women, or maybe you can't get women. Is that the problem? Like women don't want to be with you? Because your idea of masculinity is you want to be strong. You want to play dress up and put on camo and carry weapons on the street and push down minorities, women and children to show how strong you are. I think strength is going to help my neighbor who couldn't take her car out, who was struggling. I think strength is protecting people who can't protect themselves. I think strength is helping people who are in need. Because I don't need to make people less for me to feel more. I believe we are all in this together, and I can help you. Even you who hates women, or you who hates other people, or says terrible things, need help. I will help you. Because I believe that's what strength, and that's what progress is. Ever since people like believing in freedom and human dignity, people have been calling me names. They told me I'm a woman, or I'm a cuck, or I'm a bitch. And I want to address this in a serious way because using the term woman as an insult tells me people have a very different idea of what it is. Because to me, women are nurturers, women are givers of life, women are the reason we're. He should be good.
Getting big. Long stare there. You give me the 1,000-yard stare. Like there's acting. I'm acting with you're acting weird. All right? Okay? You didn't walk up. That, what do you want to get closer to me? I mean, I don't understand.
This man ends up detaining the officer, and it's hilarious. A twist you don't see very often. Instead of the officer controlling the interaction, the man on camera takes charge and effectively turns the stop around. He knows exactly how to handle police officers. His name is Travis, and if you don't know him yet, you will by the end of this video. This part of the encounter unfolds in a parking lot on the west side of the area, near the auto care side of the store. At first, there's no direct contact. The officer positions his vehicle nearby and watches from a distance. Travis moves.
No, I like court battles. Yeah, I love court. Just this man used his dash cam to immediately stop this cop's power trip after he accused him of speeding and following too closely. Oh, follow bug. All right, I got it on dash cam when you press your brakes, and then that's when I got close to you. I didn't, and they almost crashed. You need to go check on them. Like, what's up? I didn't almost rear you. I can pull it up. Speeding? I wasn't speeding. That displays my speed as well. No, I like court battles. Yeah, I love court. I got good money for a lawyer. All right. No, I like court battles. Every God. Cycles. I'm my no. Right, love.
I've been thinking about healthcare.
When you become you do that very, very period or his heart rate's not pumping.
Dose epi, 0.1 milligram, fully for urine stabilizer, receipt pink, provinet.
They're giving epi, so they're giving pressor to increase blood pressure. I'm surprised that they're not giving him if he's fluid responsive.
So like that down to 90. Another 0.1 of epi. Plastic paralysis of all four extremities.
What could cause flaccid paralysis? I know in babies you can have botulinum toxicity, Clostridium botulinum.
No eye movement with eye sweats. No brainstem function.
2-2.
Toxic injury, massive hemorrhage. Samira scored him to CT.
They think he has a stroke.
The son and daughter of Mr. Spencer from assisted living. Figured.
Your father has pneumonia and the condition called sepsis.
So when someone has pneumonia, there's a bacteria present in the lungs, and that bacteria oftentimes can seed into the blood and then spread throughout the body. And what that bacteria can do is create toxins that can lead someone to go into sepsis, septic shock, which means that the blood vessels dilate, they get massive drop in blood pressure, and if that blood pressure and that bacteria are not adequately treated, meaning that we have real protocols that we use called sepsis protocols, by putting on antibiotics, fluid resuscitation, by giving massive fluids to raise that blood pressure, because without that blood pressure, you're not perfusing vital organs like the brain, liver, kidneys, and you could lose your life simply because people didn't act fast enough. So that's why we try to do a good job at quickly identifying those who have infectious potential sepsis etiology and treat them as quick as possible. Hospitals are actually judged on this based on their response time to the sepsis protocol.
Hey, Pop. It's Helen and Jeremy.
Sure.
It's the nowhere man from Yellow Submarine. That's what he's calling when I didn't do my homework.
Is this his baseline?
He has good taste in benefits. This is the most important question a good doctor will ask. Altered mental status, AMS for short, is hard to judge when you're meeting someone for the first time. For me as a primary care doctor, because I have a continuity with my patient, if I see them in the emergency room or the outpatient setting, I can tell if they're altered. I can tell if they're acting differently. Something's not right. When you're an ER doctor, meeting someone, especially of old age, you don't know if this is the baseline for them, and this is how they act, even when they're healthy, or is this them acting in an altered mental state because there's a stroke happening, there's worsening sepsis, and that's why a family being at the bedside increases the possibility for better healthcare communication. Obviously, there are extreme examples of the family's combative, but there's arguments of the family that it could be more drama, but in general, it's good to have a healthcare advocate.
Why don't we step after what we're saying?
In a situation like this, it's good to talk about end-of-life care. What should be done if a person's heart were to stop? This is happening here during an acute case of sepsis, which is obviously very, very important to talk about, especially someone who's of old age and not living the greatest quality of life, because clearly they're still dementia well. It's equally as important to have that same conversation with people who are young entering the hospital or going in for their preventive visits, because you always want to make those decisions when you're of right mind, or at least put someone in charge as a healthcare proxy, power of attorney, to make those decisions for you if you're incapable, because you're sedated, because you have an injury, etc.
Your dad has an advanced directive expressing his wishes, which says that IV fluids and medications are okay, but no artificial life support, no CPR.
He doesn't want a bunch of machines keeping him alive.
Okay. Then we will continue with oxygen and IV fluids and antibiotics. But if his lungs stop working, we're not going to place the tube in his windpipe for breathing.
But pneumonia is treatable.
Oh,
most of the time it is.
The right way to talk about this, and he's doing a great job, I'm not critiquing him by any means, is explaining that while a condition might be treatable, when someone comes in of old age, frail, already living worse quality of life than they want to, and then they get a bacterial infection on top of it, that's a huge stress on their body. And how they respond to that is up in the air. Once their heart stops and they need CPR, they need breathing tube, the chance of bringing them back is already quite low. That's number one. Bringing them back brings so much stress onto their body that their new baseline, even in the best case scenario, is going to be significantly worse than when he came in if everything goes according to plan. So while pneumonia is treatable, while we can bring people back from CPR, it's not always advisable. And that's why patients make an advanced directive like this, January.
But if you can get better with an hemolysis.
It's not human.
Do either of you have durable power of attorney for healthcare?
Yes.
Okay. Well, this is a decision that does not need to be made right now. Why don't you think about it? Talk about it. If things get worse, sometimes allowing for a comfortable natural death can do the most you need about it.
Very true. And talking about it very honestly, matter of fact, is very good.
So, yay?
It's good, challenging. Learned a ton.
I just use the pit.
Oh, I have a sister with special needs, and she got into this really great facility here in Pittsburgh. And DCMC has such a great reputation, I thought, it'd be a good.
Can I present what I had too?
Yeah, what do you got?
This is exactly how it happens when doctors meet younger interns, residents, etc. They learn something about them, like one big, like the instrument they play, or their previous medical school education, and they just focus on that. And it's not because they don't care. It's because the facility's so busy, but you want to create some rapport, so you find it on one specific point of curiosity, of relatability, all of that.
36-year-old woman with severe headache due to paracervical trigger point. Her pain went from 11 to 0 after 2 cc's of Iammarcane.
Wait. You did a trigger point injection before presenting the case?
Yeah.
Interns always present first.
Someone coming in with a headache, immediately to go in with a trigger point injection in the ER is very aggressive, and even more aggressive for an intern to do it without speaking to an attendant first. So this is definitely breaks protocol. Because there's a whole host of things that need to be ruled out that are life or death before you start just giving someone numbing medication as a form of trigger point injection.
I spent a month at the pain
No,
clinic.
it's not coming.
Very comfortable.
It's definitely not okay.
23-year-old Ben Temper, no helmet, gun door riding. Neck was in handlebar, then face planted to the pavement. Obvious facial fractures, but alert and oriented with good vitals. How we doing, Ben?
That's probably from the nosebleed. Short rapid rhino, please.
That's the rhino rocket that you may have heard me mention in the past on the channel, where they inflate basically a giant involved tampon-esque device inside the nose to prevent blood going from a fractured nose into the back of the throat. Very uncomfortable. Not good for the digestive system and can lead to choking.
I'm gonna stick something in your nose to stop the bleeding.
No, Martin,
That means no blood in eardrum, which could be a sign of vascular skull fracture.
What's up?
Good vitals. A&O.
A&O means alert and oriented. Ideally, you want to do A&O times 3, which means alert and oriented to time, person, and place. So you do you know what day it is? Do you know where you are? Do you know who you are? And sometimes people throw in a fact like who's the president or something. Oh, that's a zygomatic fracture if I've ever seen one. Floating face.
4-3 fracture.
See that? Actually, maybe that's not even a zygomatic arch. Maybe it's like sphenoid. I don't even know what's broken.
Enemy needs us on board.
Pulse ox holding a 94.
So they're sedating him.
Just in case.
Let's have a look.
lots of swelling, I can't see the cords.
All right.
We're down to 85. I'm trying to figure out if they can put in a breathing tube through the mouth, but there's a lot of edema, aka swelling, because of the serious nature of the trauma. So they're talking about cutting in directly into his windpipe, into the area right here.
You've done this?
Yes, in this cadaver leg.
Let's hope that's no rinse pour someone's up. Open technique since we have a minute.
Very important why they do a vertical incision here. There's two very important blood vessels that run side by side. So if you were to make an incision like this, very possible to cut those, massive bleeding, potential death. So you want to be very careful and do the incision vertically.
Give it back to Craig.
CJ, no worries.
End-tidal CO2 is yellow.
It was yes, nicely done, so it is.
Sometimes if you don't put it in the right area, which here it's a much lower chance that it can happen. When you're putting in a breathing tube, it is possible to put it into the wrong hole, literally. And as a result, when you pump, if you don't have carbon dioxide coming out, you suspect that you inserted into the wrong hole and you reinsert. We do chest x-ray to confirm placement. Back to the pin just a second, but first I want to tell you about Grammarly, an AI writing partner that works seamlessly with your everyday apps and helps you.
Well, you use it without breathing.
He's breathing now.
Not honestly. I just didn't wake up. We certainly hope so.
Really, when we know more, is less so about test results when it comes to neurologic injury, but more so when we see improvements. So a lot of times it's a watch and wait approach, which is terrible for families because you don't have a good prognosis to give them. And that happens very commonly with strokes, with head traumas, and hypoxic injuries, like what happened here, where his heart wasn't beating strong enough to perfuse the brain. As a result, there was some kind of injury happening. But you don't know until you start seeing recovery with support that you can give for all of this possible things that you're correcting, blood pressure, helping him oxygenate, etc.
Are you sure that he didn't take anything that could have caused this?
No, he's a good kid. He's in college. He has a part-time job. He can tries to live at home so he can focus on school.
Dr. Ravi, the human.
With that?
It's a drug test. And it is positive for fentanyl.
Oh, he took fentanyl and he gave Narcan. I'm surprised there was no reversal.
Not arsenic.
Maybe he didn't know that he took something with fentanyl. I don't know. My bandage is spending time in there. We've got some more tests to run. We'll know our options after that. In the meantime, why don't you take a seat, talk to him?
The problem with fentanyl and why it causes overdoses so rapidly and so aggressively, this is a medication that's dosed in micrograms as opposed to milligrams. That shows you the potency of the medication, how easy it is when there's some of it present in not validated amounts, how easy it is to overdo it. And if you think about drug dealers who are selling drugs and they're trying to make them more addictive, if you put opioid medications like fentanyl, a tiny amount, you can make that medication more addictive, making people want to buy more. But the problem is, if you mess up that dosage even slightly, again, these are micrograms, talking about tiny, minuscule amounts, you can kill someone. So unfortunately, that's how these situations oftentimes play out.
People make it. It was fun in Narcan.
I think his pinpoint pupils just growing emotions from instant death.
Mr. Spencer's room.
What is happening?
His oxygen levels are dropping. Mr. Spencer, how are you feeling?
I don't remember where you were.
Mr. Spencer, do you know where you are?
So remember, he has baseline dementia, and on top of it, he has sepsis, which makes it already a higher chance of developing altered mental status, even if he was perfectly healthy to begin with.
So loud in here.
Dad, do you know where you are?
Dad, look at me. What's my name?
Muting the alarm is a good first step here, because sometimes the alarm makes the families panic. And in fact, if I have a patient on a do not resuscitate order or comfort care orders, I already have the alarms pre-muted to make sure that we're not scaring the families, because they already have a plan in place. There's no need to alarm us if the plan starts actually happening.
I passed it to number 5.
So this is where he's having air hunger, shortness of breath. Usually in a situation like this, if we're focusing on discomfort, we recommend the dosing of morphine in order to decrease that air hunger to allow him to feel more comfortable. Because one of the effects of morphine is not just pain relief, but a decrease in that sensation of feeling like you have a lack of air, which makes people feel comfortable.
What's BiPAP?
BiPAP is a breathing machine that you put over the mouth that provides a little bit of breathing support, more so than a traditional mask, because it provides extra pressure.
It is a pressurized air mask that can improve his oxygen. Either his pneumonia is getting worse, or his heart couldn't handle the fluids that we gave him to treat the sepsis. His lungs are filling up with fluid.
Can't you take the fluid away?
Now without his blood pressure crashing.
So that's always this fluid balance is at odds when you have an elderly patient with a slightly weaker heart, because think about it this way. Blood pressure drops because the patient has infection. In order to raise that blood pressure, we can do one of two things. We can give them a massive amount of fluid, or we can put them on artificial pressors. Artificial pressors, like think about adrenaline. So usually we start with fluid, and if we give that fluid, we start increasing the amount of demand that's being placed on the heart because we're increasing the pressure and we're increasing the fluid load into the heart. If the heart starts struggling with that extra amount of fluid, what ends up happening is that fluid ends up building up and backing up into the lungs. And we start also seeing it like on their ankles as well. So again, backing up. Patient has infection. To treat the infection, we need to raise the blood pressure so they don't die. We give fluid. They become fluid overloaded. Fluid goes into the lungs, makes the problem even worse. Don't give enough fluid or give them medicine to get rid of the fluid, which is called Lasix, the generic being furosemide. They can pee out that fluid, which is a good thing, but then again, we're lowering their blood pressure. They're not supplying enough circulation to their brain and vital organs. So there's no good place to go here.
Let's just hope the BiPAP works.
And if it doesn't,
BiPAP also creates that pressure, which can help get rid of some of the fluid from the lungs.
Then I would need to know your decision about using radiation.
We're still talking about it.
Well, we know he expressed his wishes in writing to not intubate.
We're thinking try it for a week.
That would be a very painful week.
Every time a patient is intubated, not only are there monitors, there's blood draws every morning. So imagine he's getting from it every single morning, because we want to make sure that the intubation settings are correct, that the patient is improving. Patient's not going to be getting a lot of risk. It's literally, you're getting all the risks and harms of all the treatments, but almost no benefit. Because what's the benefit? Even if he comes out of it, he's going to be at a worse baseline than he was before. He wasn't doing great before to start. I'm saying this kind of to paint the most honest picture.
He would get a lot of rest with all monitors and blood tests. He might need to be sedated. He might need to be restrained because he'd be in an unfamiliar place with a very uncomfortable tube down his throat. And he wouldn't really know what was happening. Elderly patients can often develop psychosis.
But he might get better.
Or it might get worse. The thing that I like to say in those situations is he might get better from that situation, but for him to return to baseline of where he came in, which was already not great, is near impossible or very, very hard. What would you do?
I really can't answer that for you. This is your father. It's your decision to make.
I would just say, what would he want to be done? And he expressed it. So I feel like that's the answer.
I can guarantee you that we would keep him as comfortable as possible if a natural death is what you choose.
But he's not your father.
Very difficult discussion. He's doing a great job handling it.
Kicked off the city bus for disrupting and disturbing passengers. Maybe put a comic stuff spot an empty person.
It's really wild to say someone's drug seeking just because they found a Percocet bottle and someone's screaming for pain medicine. You probably should ask what medical condition they have. At the least.
why did you call? I'm cooperative and Travis.
Sickle cell crisis is one of the most painful things ever, and a lot of times it gets labeled as drug-seeking behavior, but sickle cell crisis is incredibly painful. Bone pain is terrible. Remember, sickle cells can create anemia where the cell itself is not a normal shape, and as a result, it causes an occlusive crisis where the blood basically starts bunching up upon itself, leading to immense pain.
Just a consulting. Yeah. 10 milligrams of ibuprofen. Yes, repeated in 5 minutes needed. And she's got a lot of notes that based off of the present. Don't try it happen. Yeah.
Live wire and stuff.
Was there a pop hole there?
No bad effect. So we'll touch that side. Electrocuted. Press the cover. Slightly. Now I fried his arm and his whole body stopped his life.
Major burns will happen. Electrical activity like that. Remember, when you shoot electric current through your body, you can disrupt the heart's natural rhythm, leading him to be in this very dangerous cardiac rhythm, which generally can be fixed with advanced cardiac life support. And I think that's what they gave him. I'm curious about his vitals. For severe burns, you need massive amounts of fluids.
Steady lit. And hemoglobin and his TK collapse.
See if there's damage.
2 liters saline wide open.
Wide open. Just maximally give as much fluid as you can. 18 gauge IVs that should be.
Like census, what are we learning?
Rhabdomyolysis.
Rhabdomyolysis is your muscles get severe damage. Can happen as a result of extreme exercise. Can happen as a result of electrocution.
Hemorrhagic damage to the kidneys, ongoing risk of cardiac irritability. Taking pads in place and ventral compartment.
When there's a tense compartment, that can lead to something known as compartment syndrome, where pressure builds up inside a limb, and as a result, you start killing off any portion of the limb. The only treatment for it is a fascia wound, where you actually cut to expose the fascia and allow the pressure to escape. So you're basically cutting to allow the patient to do it.
Anterior compartment pressure is 49.
Cause massive swelling.
With a burn, you get not just massive swelling, but sometimes you get skin contractures where the skin contracts and you have swelling. It basically creates a tourniquet on top of the arm.
Was it any symptoms?
Fasciotomy, but he still has a radial pulse.
So when you're doing the fasciotomy, you want to be very careful. There's significant nerves that lead down into the hand because the hand has really good sensation, pinpoint discriminatory sensation, and obviously for the major blood vessels as well.
This is the path to avoid the median nerve and all major vessels.
Maybe just watch the first time.
Watch one, do one, teach one.
Shoulder the blade, I'll cut. And later, Dr. Santos. And start proximal. How much pressure? Just about this much.
Yeah, ideally I would have liked to see her witness one before starting to beat it and muscles. They are out of good.
Skin and subcu.
The biggest part of why it's a little safer than you would imagine, meaning both of you, because it's really about the amount of pressure that you're applying and the depth and the location. And since she mapped it out and is controlling the depth, safer than perhaps a traditional surgery.
I heard you wanted to talk to me.
Yeah, that alarm kept going off.
Yeah, why don't we step outside? The alarm's from the oxygen.
He's in a position where you have to intubate if you actually want to do something. It's probably not the right choice. Does he need more of that on the bypass?
I'm afraid that's as high as we go. So the decision at this point,
We want you to put our father on the breathing machine.
even though that goes against his desires to not be intubated,
We're not ready to let go yet.
you're absolutely certain you want to put your father through this after everything I've told you.
Surprised that he's taking into consideration their thought when he already has an advance directive on file. I've never had a situation where a family overruled an advance directive that a patient put on. A patient at any moment could change their advance directive. That's true. So like they may be DNR, but then when they become hungry for air, they may say intubate me, save my life, do whatever, and you have to honor that. I don't know how it works exactly with a healthcare proxy or durable power determinant.
If not, you can talk to your hospital attorney.
Okay, you can sit within the door already.
What will that be?
Momentarily. You okay?
Yeah, for sure. I just seeing Taylor's 25.
You sure you okay?
Gonna get some air. Spanish, boxy, pushing, stretch, obsessive, nasty.
Well, I'm up. Oh no, they're gonna shoot him, throw him away, throw out of the big bloodshot, gunshot victim. I didn't know. I got stuck. I knew it. This literally happened to me, and I had to plug it right then and there. Oh my god, this is literally, I'm getting full on flashbacks. Except mine was kind of, it's in a bad area where you're gonna have to do something called an X-lab, which is an exploratory laparotomy. When you're gonna do a technique called running the bowel, to see if the bowel is damaged, because it's near impossible to know what the bullet impacted from just seeing where the bullet entry and exit. Only 14 gauge left AC. Systolic being 80 is a really bad sign. That means a lot of blood loss is happening, probably into that retroperitoneum area that we talked about earlier.
We got 2 units of whole blood going on the rapid acute.
Well, the OR will be right up. One's up.
Horses in full blood.
Corpse liver.
Oh, that's a lot of things. In situations like this, something that most people think about that could happen is retribution stuff. So sometimes this person went to go kill someone and they ended up getting shot, and then a gang member will come back into the hospital because that person shot their friend, and it becomes really a dangerous situation. Most people don't think about that, but hospitals are a place of revenge, so you gotta be really careful and thoughtful with security.
How's she doing?
Still breathing after 28 morphine. The reason why they're making such a big deal is because those are big doses of morphine, and some people that can cause respiratory distress. But that is in opioid naive patients, meaning those who have not received large amount of opioids in the past. Those who have gotten opioids quite often, people who have sickle cell crisis often, who have chronic pain, they become more tolerant. They can handle higher doses, and in fact need higher doses in order to actually get the outcome from the medicine.
Dangerous.
Oh, I'm a little better.
Good organ exchange transfusion.
Figured I needed that.
What's your normal rate of
90, that's morphine every 12 hours. And Mexico breakthrough pain, but it wasn't working.
Starting IV dilaudid at 4 an hour.
Dilaudid medicine I'm talking about is approximately 7 times more powerful per dose. 7 milligrams of morphine is approximately 1 milligram. How do you know she's no drug
They can't fake a hemoglobin of 6. Do you know what sickle cell crisis does to the body? Blood cells get caught and plug up your capillaries and deprive all your cells of oxygen. It's been described as an electrical stabbing pain that feels like it's breaking your bones and flushing glass through your body.
I never thought of it like that.
Little empathy goes a long way with those suffering from pain. Don't worry, you get good at spotting the fakers, and half the time all those people need is someone to really listen to them and hear their story.
Great feedback. Good teaching moment. I just probably would have done it not in the middle of the hallway, just so it's a little less awkward, but otherwise great. What?
I'm not gonna tell those parents their 18-year-old son's brain dead.
What are you gonna say?
I'm going to say that it's likely, but we still need to do an apnea test and a cerebral perfusion study.
What if we pray for miracles today?
They need time to process before they can accept what's happening.
You ever consider taking that advice? Physician, heal thyself.
Don't you have patience? Doctors are the worst patients. Just being silent president of the room is a really good movie. Raw milk is going viral in more ways than one. Click here and check that out. And as always, stay happy and we invited Hugh Morton to our show. His staff was like, "Oh, this is a good fit. We're going to reach out to him and see what he thinks." I'm going to read you quote unquote what he said. He is not interested in opportunities like this. Frankly, doesn't care about the audience or reliving the show.
That's so baller.
It's just such a direct and honest
So baller.
reply.
Pretty much a middle child pleaser. I'll answer any question you ask me.
We invited Hugh Laurie.
The happiest men over 40 are 25 pounds over.
We got a few suspicions. Pull you over. All right.
I want to bet. Nevertheless, one YT. Nevertheless, one YT says, and I quote, "Have a good day. Have a good day. Have a good day. Have a good day." Nevertheless, 0x, 0XL, 2F says, "Yo, Beast, love your." Says, "Yo, Beast, love your videos. Huge fan. Much love." And you know what 0XL 2F? Stay tuned, motherfucker. Stay tuned. Or even just stay tuned. You're not a mother freaker. I am just waiting for this secondhand medical equipment, which is being shipped from the United Kingdom. Once that stuff arrives, then I can kind of sit down and start the process of moving forward with my next YouTube videos. Stay tuned. Timothy Johnson, to you and your wife, I appreciate, you both appreciate every now and then watching some LAD's videos. I appreciate you. This is real life. Tim, appreciate you. Hope you're doing well. I'm not sure if you're still doing some open mic nights and stuff like that, but whatever you're up to, hope you're doing well. Because what is up, dude? Stay warm. Heck yeah, it's stay warm too. I know Tim. I feel like it was maybe it was like in December. Maybe it was like the end of 2025. You were like coming out the front door, like going down the ramp. There was snow on the ground. Pretty sure. So you know what? Stay warm as well. Tip. This is Dr. Mike. Dr. Mike Oxbrown. He's a huge fan. Huge fan. He loves seeing videos of your retro toys and baseball cards. What else do I collect? Do you collect comic books? I don't collect comic books. But the most recent eBay purchase, and you know what? Honestly, this entire 2026, I don't want to spend any money on anything. It's like I'm just trying to save as much cash as I possibly can. Like all the prices of everything going through the roof. I'll go get it. But the most recent thing that I have purchased. It's like I have all these
leftover. These are like 1992 Marvel masterpiece, the Battle Spectra cards, and like these are 8. These are like near mint 8. We got Silver Surfer versus Thanos there, Wolverine versus Sabretooth there, Spider-Man versus Venom. That's it. That's actually a near mint 7. That one, and then like here's an extra one here. That's a 7 as well. But the person that actually
I've been waiting for you to show up, Josh.
One from the show, Josh.
I'll have the pizza on this past. Yeah.
This past was 5 minutes.
Okay. So I'm engaging in free speech. I'm in a public place. I'm okay. Thank you. Appreciate it. Thank you. Now I gotta do records. Yeah.
Welcome to a new test and teardown video. Here, logo, forms and all that kind of goody stuff in your car. And then you take your handle and you call a central, and that central will call the telephone number you tell them to call, and then they will tell you to go to this or that channel, and then you can communicate with your friend anywhere in the world, actually. Imagine to do that in 1961. Well, that is definitely some sort of a telephone system. And of course, it would cost a big pile of money even back then. But, I mean, if you're a big boss of a huge company and you really want to feel important, of course, you need to have a phone in your car. And so this is the 615. I got the 616 as well. And so those are fully tube radios for 2 and 4 meter bands. And I also think I got the, oh yeah, this is also one of the old tube versions, the 565. And I also got the modern one. Look, this is a lot smaller. And this is the 640 series. They come in different radio bands as well. And this should be a transistor version where only
Hey, how's it going? Chris Pratt here. Look, I know this is totally out of the blue, but could you stop and pray with me real quick?
Hi, it's me, Tim Dodd, the Everyday Astronaut. There's nothing more exciting than an awesome rocket concept, a new mission to unknown worlds, or an exciting breakthrough in technology. But unfortunately,
For big kids at your own house. Now, to get started with programming, you're going to need mainly two things. One, you're going to need a pass-through device, and two, you're going to need a laptop. Now, pass-through devices can look very different depending on the brand. Here's one from Launch, and this is the one I like from Topdon. It's called the R-Link. There's ones from Bosch and Snap-on, and they can get really expensive. But this Topdon R-Link sells for around $300 on Amazon. And it works with OEM Nissan products, which I program a lot here. But it'll work with any make, any manufacturer, and you can probably get it here by the end of the week because it's available on Amazon Prime. Now, a laptop can get pretty expensive, and basically all you need to have in a laptop is a good processor, preferably like an Intel X5, and a lot of memory. I mean, preferably at least 500 gigs, but a terabyte works even better. Now here I got an X1 Carbon ThinkPad, and I bought this thing off of backmarket.com for around $350, including my $300 pass-through device from Topdon here. I'm in total for this setup for around $650, which is really cheap to start programming vehicles.
Backed by popular demand, there was a literal outcry when we missed episode 10. I get it. They won the Emmy. I was there to celebrate with them. Great times. If you're an editor, know that I am looking for you. We are hiring. The information is down below. Fill out that Google spreadsheet. Let's get started.
Teddy, 28 years old, burned in a gas tank explosion. Paramedics estimate 90% BSA.
Oh, that's a body surface area. That's incredibly dangerous. Not only is the person going to be in a tremendous amount of discomfort, pain is interesting because if you have third-degree burns, it really sears off the nerve endings. Therefore, you don't feel pain. Now, I've had patients who've had third-degree burns. They tell me it absolutely does hurt. I guess it really depends on the situation. Then you also have to really carefully manage electrolytes because when you have that much skin damage, you have electrolyte abnormalities. You can dehydrate quite quickly because skin actually acts in a way where it prevents water loss. Very dangerous situation. Very, very dangerous.
Vitals are good. Pulse ox 97. Teddy, are you in a lot of pain right now?
As much as I should be.
Yeah, see, so those nerve endings are most likely charged. And you know, when people say first, second, third degree burns, what they're really talking about is how far the burn goes deep. So a first degree burn is just the superficial epidermis layer of the skin. Second degree is considered a partial thickness burn where it's epidermis and partially the dermis. Third degree is a full thickness burn, epidermis, dermis, potentially muscle, fat, bone, tendon underneath, all of that.
Mainly third degree.
Yep.
Singed nasal hairs, sudden oropharynx. Do you have family in the way?
My wife
Well, what happened?
was transferred gas, 200-gallon field tank to my tractor.
Let's set up for intubation.
Also really dangerous because he's going to develop contractures, which can lead to something known as compartment syndrome, where certain areas might not be getting perfused with blood, therefore develop hypoxia and necrosis. They're the situation quite thoroughly. That's why we have dedicated burn centers in a lot of hospitals or in a lot of regions, because it's a very specialized team that needs to take care of these patients.
That's it. What?
Jesus Christ. Oh, get her into a room. She's a patient now.
Very nice fence.
I got the cart.
Does he know what happened?
What happened?
Just got punched.
She's such a champ. Just got punched.
It's an unhappy patient. A patient hit you? Happens all the time. Got my cheek broken.
I lost it too.
Oh, we've all been assaulted.
Yeah, assault on healthcare workers, as Noah said on our podcast, it's so underreported, undercounted, undertried in terms of our legal criminal system. A change needs to happen because it's just not right that first responders, nurses, physicians, even EMTs face such abuse on the front lines without truly being protected or compensated fairly.
Did you do it?
Hi. Probably. No LST, just my hands.
I'll get pressure.
With a bloody nose to that degree, it's very possible that it's broken. And in a situation like that, you have to make sure that there is no septal hematoma. If there is a collection of blood in the area where the septum is, you need to drain that quite quickly. That's an urgent intervention because if you don't, it can actually lead to necrosis from putting pressure on the area where there's not great circulation to begin with. And as a result, you can develop a saddle nose deformity. Here's an image of that. And you obviously don't want that to happen in order to have healthy breathing.
Any trouble saying any double vision?
No. I'll turn to these friends.
You got a headache.
Yeah, but
You need to find her a room.
I do not need a room, Dave. Who knows what is all
On my finger?
So follow ensure that all of the orbital muscles are intact that attach to the eye. These are neurologic, neuromuscular tests, but also checking for fractures because if you do have a fracture, let's say the floor of the orbit, sometimes that can impact nerve and muscular function.
Your arms intact?
I'm gonna go check.
Pupils are overreactive. No septal hematoma.
Oh, my guy's making all the right choices. I'm acting like I'm the ear doctor when I'm totally not.
Tell me when it's sore.
So a lot of times for nose fracture, you don't need to do surgery. Again, if there's a septal hematoma, you might need to drain it, but a lot of times you can do a closed reduction.
And do today's CT head maxillofacial.
Give them my heads up.
If you do an X-ray of the area, you get a two-dimensional view, and sometimes it's really hard to actually rule out if there's a fracture happening. That's why you need a CT scan of the area. Normally, I don't like ordering CT scans of the head, but in a situation like this, when she took a fall, maybe got knocked out, that is a mechanism of injury that is compatible with getting a CT scan.
You guys staying ahead with the fluids?
Per the Parkland, 4 per kilo times 90% burn. Wow. 27 liters over 24 hours. He said 2 so far.
That's the equation that they use to decide how many liters of fluids they're going to give back to this patient. You have to be very careful when ordering fluids where you don't want to overdo it, you don't want to underdo it. And remember, if you have burns, you are losing more fluids, much in the same way, obviously to a smaller extent. If you have a fever, you lose fluids more rapidly. If you have diarrhea, you lose fluids more rapidly.
Stable for now.
Okay, good.
Ready. You've got severe burns covering most of your body. You've also burned the inside of your throat. Just to be safe, I need to put in a breathing tube and you won't be able to speak.
We need to do this now before his throat swells and it becomes difficult for him to breathe. So if there's anything you two want to say, we chose this at the time.
They're doing this very smart because they're doing it prophylactically. They don't want the throat to swallow, then it becomes very difficult to get an airway. Then you would have to make an incision in the throat. Whereas right now, the swelling hasn't started yet. You can get a good airway in, will protect the airway, would allow him to keep getting oxygenation, and allow him to recover while under sedation.
What is going?
Code stroke means that someone's either having an ischemic or a hemorrhagic stroke. Those are the two types of strokes. Ischemic being that there's a blockage in blood vessels that supply oxygenation and blood flow to the brain. If you have hemorrhagic stroke, that means a blood vessel has ruptured and then there's bleeding into the brain. Both are actually the same problem in the sense that they're not receiving oxygen. One is a problem of a blockage not receiving oxygen and blood flow. The other one is because there's bleeding, therefore you're not getting oxygen and blood flow. And the most important thing when you're finding a patient who has a stroke is time. You want to act as quickly as possible.
Jane Doe, looks like she's in her 20s. I'll be aphasia, right sided hip, braces, and facial proof.
All right, so what they're describing here are important factors to think about when there's a stroke. We have an acronym. The stroke organization views FAST as an acronym. I like BFAST, and each letter has a different meaning for it. B for balance, I for eyesight, FACE for facial asymmetries, A for arm weakness, S for speech abnormalities or difficulties, and T, the most important, time. The reason time is so important is that you want to minimize the amount of time that the brain suffers hypoxia. Because what happens is if you have a very long time where the brain is hypoxic or the region of the brain is hypoxic, not receiving oxygen, damage can happen, so much so that even if you open that area after the fact, the damage can be permanent or even become worse, where an initial infarct in the brain starts actually spreading. It's called the penumbra.
Open your mouth. Gag reflex present?
It's important to know if the gag reflex is present as it gives you some idea of whether or not the patient can protect their own airway and whether or not they need to be intubated.
Straight radiology. CT brain without contrast, perfusion scan, CT angio, head and neck.
Yeah.
Who gets a stroke in their 20s?
I would say one of the most common causes of a stroke in someone in their 20s, outside of having an aneurysm that ruptured, which actually happened to the actress on Game of Thrones, is if you have a hole between your two atria that has not closed, and as a result, a blood clot that potentially can, let's say, happen in the legs from sitting for too long, actually makes its way up the venous system, and then because there is that hole, ends its way up into the left side of the heart, and then gets shot out to the circulation, potentially the brain, causing a stroke.
Then can you close your eyes for me?
Robbie, it's Samira. Endo CT came back. No bleed, but there's a carotid artery dissection left neck with a thrombocyte through a clot to the left middle cerebral artery.
Wow. That was way more than what I expected.
No intracranial hemorrhage. She might be a TMK candidate.
But couldn't TNK cause a brain bleed and kill her?
TMK is still the best clot busting possibility.
Shouldn't we do endovascular therapy? I mean, that's the safest option.
So there's two ways that you can go about dealing with a clot. You could either have the endovascular team pull the clot out, go in and pull it out, and another way is to use a clot buster to actually break up the clot. I don't know the exact distinctions that need to be made of who's high risk, who would benefit from each operation. I'm sure there's a whole criteria that ER physicians use. But I'm surprised that they're not deciding that based on some criteria as opposed to just arguing amongst themselves.
What do you call a Tyrannosaurus under stress?
What?
Nervous Rex.
Dr. King, Dr. Matha, one of our esteemed stroke neurologists. And I have stroke scale of 27, no last normal time.
The problem with giving clot buster is if you don't know the recent stroke time, it can actually be more problematic in case increasing the risk of a bleed. So I think that's when endovascular is the correct move. But let's see what happens.
Dr. Meta, shouldn't we take her to EVT?
Not yet. Take first spin the MRI, check for irreversible damage first. There's a diffusion flare mismatch. She's still in the window for thermal rings.
And she's still gets EVT. 2-for-1 special.
What type of person is best suited to work with an MRI machine?
A trained technician.
Someone with a magnetic personality.
You can driver's license and insurance card, Mr. Puglisi, have a seat, and the triage nurse will call you back soon.
Like, hello, my son needs help in dying.
Let me ask you about your eye. You think a line just cut?
Big, it's an emergency.
You think everybody's waiting medically?
You caught a line drive to the eye.
We're so sorry, man. We thought this was. I'm 16.
Show her. Show her.
Oh, that's a lot of swelling. Orbital fracture. A lot of times when a baseball hits the orbit there, you get what's known as a blowout fracture in this thin area on the inside of the orbital area. That is quite painful, lots of bruising. You could also have a ridge fracture a little higher up, but this bone is a lot stronger. Obviously, the floor can also be damaged, the orbital floor, but there you'll start seeing neurologic signs, muscular issues where the eye can't move into a certain direction. Obviously, you want a CT scan urgently here.
Tell me how many fingers have moved out.
I can't tell.
Oh my God. Again, orbital floor could create issues with the nerve. Also, hematomas, swelling could put pressure on the nerve, making it difficult to see as well.
Okay, tell me the light turns on.
Now?
Light perception only. Do you want a portable slit lamp? Definitely, yeah. It's running the anterior chamber. Peggy, exactly. Grade 4.
What you can develop here is called acute orbital compartment syndrome, which is what I was saying earlier. When you have a fracture, you develop a hematoma, and the hematoma starts putting pressure, essentially cutting off. What you can develop here is called acute orbital compartment syndrome, which is what I was saying earlier. When you have a fracture, you develop a hematoma, and the hematoma starts putting pressure, essentially cutting off.
become the problem. Dealing with suspects includes patients with doing counts that ends badly when the truth comes out fast. In these cases, officers push too far, underestimate who they're dealing with, and spark reactions they didn't expect. Let's watch how smart citizens stand their ground.
What? Not calling to ID, just committed a crime.
At the start of the video, a police officer approached a man standing on a public sidewalk holding a sign. Within the first few seconds, it was clear the officer wasn't there to check on safety, but to look for a problem where there wasn't one. And honestly, I don't know about you, but it looked like a classic attempt to control speech.
Why not? Because there's a city on the Supreme Court's already ruled it's free speech. No, asking for money is free speech. You do have rights, and you cannot. So, well, your ordinance is going to get you constitutionality. No. I can ask people for money. I can ask people for money. You guys do it all the time. No, you don't. No, you don't. It's free speech. Can I have some money, officer? Keep doing it. Can I have some money? No. Can I have $1? Can I have your ID? No. Yes, I can. Why? Because I'm getting ready to take you to jail. For what? For not calling to ID when you just committed a crime. You said you would cite me for it. I will cite you. Cite me for it. I will cite you. I gotta take you down there. Oh, I thought you had a book. I thought you had a book. Your ID? Oh, I don't have my ID on me. Okay, what's your name? Yeah, sure. And what's your name, badge? That's your red. DSN 406. All right, thank you. You're on the sidewalk.
As the conversation went on, the officer tried to push a city ordinance as an absolute authority, ignoring the basic order of rights. A city can't cancel the Constitution with an ordinance, but the officer acted like that didn't matter. Because of this approach, he risked a direct clash with the First Amendment, but that clearly wasn't important to him, as long as he felt he had control and power in that moment.
Yeah, protected free speech. I can't do anything about that. Okay? Yeah. You can't. You need a permit from the city. Think about what you're saying. You need a permit from the city for saying God bless the homeless. It's already been a permit. For saying God bless the homeless. You just said you're asking for money. To you. I just asked you for money. No, you said you were asking for money. No, I never said I did ask for money. This, or do you want to just? I know what I'm doing out here. I have a right to stand out here and say God bless the homeless. I asked you for money, challenging your, because I asked you if that's what you were doing. You said, I'm not asking people for money when they're driving by. If you want to keep playing this game, we'll keep playing. There's nothing about a game I'm playing right now. I'm out here engaged in constitutionally protected activity, saying God bless the homeless. You said some speech thing, some ordinance, city ordinance, about asking for money.
The officer claimed that asking for money isn't free speech, despite decades of court rulings saying the opposite. I mean, by that logic, speech is only allowed when it's comfortable for authorities. That's no longer free speech, it's a privilege. With behavior like this, the police are basically setting themselves up to trip in front of a federal court.
Supreme Court, they've already held up. We've already had one go to the Supreme Court as well, and it's upheld. So what did the guy say? Was he asking people for money? Was the guy asking people for money? Homeless. I told you, that's not an issue. You're standing here on the sidewalk. Yeah, but even if I were to ask people for money, that's not illegal. Yes, it is. No, it's not. It's our city ordinance. Your city ordinance has already been upheld. It's unconstitutional. I'm not gonna, I just said it's already been upheld. By what? The Supreme Court has already. By a guy standing on the sidewalk. And I highly doubt that. I don't care what you highly doubt. I already know I can write it, and it's gonna be upheld. Now, if you're asking for money, you're begging out here, I will get your ID and I will do what I need to do. If you're just standing there with your sign, great. I might be saying God bless the homeless. I might be asking people for money. You never know. I'm not going to admit to it.
Since he had no proof that the man was breaking the law, the officer tried to push him into a confession. That's where the problem became obvious. Instead of enforcing the law, we were watching a fishing expedition for reasonable suspicion. If this isn't a desperate attempt at manipulation, I don't know what is. There's no violation to point out, just pressure to say something wrong.
Do you have any proof that I was asking people for money? Other than you saying a while ago, I asked you for money. And I walked up here, I asked you, and you said, yeah, I'm asking.
No, you didn't say that. I didn't. No. You got it on camera. Go back and listen. Oh, I'll listen to it, but I definitely didn't say I've been asking people for money. Listen, man, I'm not trying to be a hard time. Yeah, you know what your amendment. Yeah, you know what your rights are. Okay? Do you? And that's good. I want you to do what's right. Yeah, yeah. I still have the right to ask people for money. No, you don't. And why do police officers and firefighters stand at the side of the street holding out a boot for people's donation? That makes no sense. That makes no sense. We have the right to stand out here and ask people any questions we want. You cannot beg people for money on point in this city, okay? We do have an ordinance against it. Just letting you know.
The officer threatened arrest for failure to identify, even though there is no underlying criminal offense. And that's a serious mistake. Without a lawful detention, there's no duty to identify. Because of this behavior,
believe.
This time with the Sony TCM 150. It is a Sony, and it does play cassettes, but it's not a Walkman. A voice recorder at the back, using portable and easily replaceable standard cassettes, and powered by just 2 AA batteries. The TCM 150 at low operating cost. The recorder also has a number of useful features, including one-button recording, a large playback speaker, an earphone jack, and Sony's Clear Voice recording system. If you're looking for a way to record on a budget without complicated or hard-to-find media, the TCM 150 answers the call. The TCM 150 was introduced in 2002, and in 2009, B&E
So this is crazy. What have you done? Another year over, and you won't just begun. And so this Christmas, I hope you have fun.
Sorry?
What's your name and personnel number?
My name is Sergeant Cook with the Nevada Highway Patrol. Okay. There's adequate signage up here that told you as you approach this that this was a DUI checkpoint, correct? Did you see those signs? I did. Okay. You had the opportunity to turn or proceed. You chose to proceed through. Okay. So now you have to submit to our questions, and that's it. It's a simple question. Whether or not
You can ask all the questions you want. I'm not obligated to answer, sir.
okay. That's what we're trying to determine is yes, have you been drinking tonight? Okay. Do you understand that?
I understand that.
Okay. Are you
I'm sorry?
are you a lawyer?
I'm not a lawyer, but I am aware of my First Amendment.
Okay, well obviously you're not aware of it because you pulled up into a DUI checkpoint, which we've lawfully established. Okay? We have requirements to put signage at so many feet, okay, which gives you the opportunity, if you don't wish to come through, to not come through. And you understand that?
Yes, I do understand.
Okay, so you chose to come through the checkpoint. Okay? So all we are trying to ascertain is if you are right.
Okay. You can ask all the questions you want. I'm not obligated to answer, sir.
Okay. Have you smelled anything on this one? I wasn't able to smell it because it was winter roll that lush. It was basically water right from so I was able to ascertain and ask him a couple questions, so he's going to answer your questions. Okay, does he identify himself? Yes, sir. You have a driver's license, sir? I do have a driver's license. May I see that? Sure. Thank you, sir. You're welcome. You have any weapons in the vehicle?
Yes.
Okay, where is that? Just so
It's on my
It's
right hand.
Okay, as long as you don't reach for it, I don't have a problem with that. Okay? Okay? So, can you still live on Rainbow?
Yes, sir.
Okay. So, you understand what we're doing out here? We're not trying to harass you. Okay? This is just a simple DUI checkpoint. Okay? You roll down the window, we can smell inside the car. That tells us whether or not you've been driving. You understand that?
I have been driving. I do.
No, I mean drinking and driving. Okay? Okay? I mean, I'm not trying to be smart with that. It's been a long night. Okay?
It's been a 14-hour day for me, sir.
Okay, well, understand that when you pull this kind of crap, and I'm gonna call it crap, because you roll up to a DUI checkpoint, follow up on your loss, okay?
I'm well aware of the law involving the DUI checkpoint, so you have the ability to stop me briefly and detain me for 20 to 30 seconds.
If you don't wanna communicate with us, we can't determine that, right? So, we have a job to do, okay?
I understand that.
That's all we're trying to do. But obviously, you don't like us. And
It's not that I don't like the police, sir. I don't like being stopped when I'm trying to travel unmolested. I am in America. I shouldn't have to stop and give my papers. This isn't Nazi Germany. We're not in Mexico.
look at the laws as far as DUI checkpoint, okay?
I have.
So obviously,
1990, a ruling was made by the Supreme Court that you could stop and you could ask questions, but people are under no obligation to answer those questions.
and you roll your window down like this, we can't answer those questions. Okay? We can't ascertain whether or not you've been drinking and driving. It's a simple 2-minute, if that. Okay? So,
Am I free to go or am I being detained?
no, I'll be talking to them. That'll send people. Nice, nice.
You too.
Drivers in Nevada have the right to remain silent beyond providing identification documents, and this driver knew it. The 1990 Supreme Court case Michigan Department of State Police versus Sitz held that DUI checkpoints are constitutional, but they come with strict limitations. The checkpoints must be brief, minimally intrusive, and conducted in a systematic, The problem starts when the first officer immediately escalates. The driver refuses to answer investigative questions, which is his Fifth Amendment right. Instead of accepting this and moving to the next vehicle, the officer demands he exit the car. There's no articulated reasonable suspicion at this point. No odor of alcohol mentioned, no observation of impairment, nothing beyond the driver exercising his constitutional rights.